It's important for women to see a doctor, especially their OBGYN physician, prior to conceiving, so they can talk about any chronic medical conditions that they may have that need to be under good control prior to pregnancy to have the healthiest outcome for the mom and the baby during the pregnancy as possible. So it's really important to take prenatal vitamins, most especially the folic acid that's in the prenatal vitamins, because this helps prevent neural tube defects. You should be taking a prenatal vitamin that has 0.4 to 0.6 milligrams of folic acid prior to conception and for at least the first 12 weeks to help prevent open neural tube defects.
We need to maintain a healthy lifestyle, and that, in my opinion, is going to include a good, well-balanced diet, fresh fruits, veggies, lean meats, and good, reasonable portions of carbohydrates.
But what's important to know is that you aren't necessarily eating for two separate people. You don't need to double the amount of calories that you're taking in. You are going to be hungrier, you're going to be burning more calories because you are pregnant, but it's important to really limit what you're taking in to healthy foods, to good fruits and vegetables and some healthy dairy products.
Physical activity is definitely going to be helpful around the time of labor. Labor is a big aerobic workout, and so training appropriately for that with daily exercise or exercise a few times a week is going to really help with the labor process. Especially living in South Carolina, where it tends to be really, really warm in the summers, and we can see a lot of dehydration. Pregnant women will tend to feel better on the whole if they maintain good hydration, and that means 6 to 10 glasses of water, juice, or milk in combination throughout each day of the pregnancy.
Every pregnant woman, everybody needs a flu shot, but especially pregnant women. You can get very sick very fast with the flu when you're pregnant. A lot of women are hospitalized when they're pregnant with the flu.
So it's very important for all people to wear seatbelts, but especially pregnant women. A lot of people think that they shouldn't wear a seatbelt because their belly is increasing in size, but actually if you're in a car crash and the car jars forward and you jar forward and then backwards, this can actually cause damage to the placenta. So the baby's more protected if you're restrained against the seat.
Breastfeeding is something that you really ought to think about before you even deliver and decide whether or not it's something you want to do. Breastfeeding moms tend to lose weight faster. They tend to stop bleeding faster. They have a lot more bonding time and more successful bonding with their infants. Their infants have fewer infections.
Well, it's normal after a delivery, a couple of days after delivery, for most women to experience some anxiety, sadness, and feelings of being overwhelmed about having the new baby at home. But about 10% of women have these symptoms in a very severe form, and the symptoms actually interfere with their activities of daily living or their ability to care for the baby. And these women should seek help from a physician for these symptoms.